So again, thanks for joining us this morning. And with that, I'll turn it over to Tom.
Well, thank you, Nate. And I want to welcome our whip, Steve Scalise, to this call. And we'll hear from him here momentarily, and I'll do an introduction for him. But I just want to thank all of you in the press also for attending this press conference and also to raise awareness on this critical issue that has impacted our grandparents in such a devastating way during the course of the COVID-19 crisis. What we're here to discuss today is the horrific handling of our grandparents when the crisis started in early March, and the executive orders issued by Governor Cuomo in particular. The particular executive order that's most egregious is his direction that COVID-19 positive senior citizens, our grandparents, were forced to be put back into the nursing home setting and expose their fellow residents to the COVID-19 virus. It had devastating impacts. We know black and white that at least 6,200 of our grandparents were subject to that order that killed them as a result of this complete horrific decision by the governor. Since that time, it is clear that there are many more thousands of grandparents, not only in New York, but across the country. And that's why Steve Scalise is here, because he's taken a leadership role in regards to investigating this nursing home crisis in America during COVID-19. But we estimate potentially as many as twice the number of 6,200 of our grandparents were killed by Governor Cuomo's order in early March, directing that those with coronavirus had to be put back into the nursing home setting. This is a complete failure of leadership. And I will tell you, it's even more egregious because we watched this in real time. I've been dealing with this issue from day one in early March because we did daily calls with our hospitals, we did daily calls with our health networks, we did daily calls with those facilities that had control and responsibility for nursing homes. And I heard the concern for these people in real time, and no one would listen in Albany in regards to this horrific order. And to make it even worse, if you look at the Society of Long-Term Care, they wrote the governor the day that he issued this order, and it was received at the governor's office the following day, that this would kill our grandparents if this order was not rescinded immediately. So he had prior written notice that his decision was going to lead to the death of at least in black and white 6,200 of our grandparents, potentially up to 12 to 13,000 of them in New York. I got to tell you, if you want a show horse running the place in New York, and that's what these press conferences were all about, and I guess he handled them very well, given the favorable reviews that he got from the folks out in the public press. But I'll tell you, when you peel back the onion, when you peel back the curtain, there was no workhorse in that office. There was no responsible leader making these decisions. And then, when he made the decision, stuck by it for 46 days. And then, when we finally put enough pressure on him to rescind the decision, he has the audacity to insult those grandparents who died and their families to say, oh, this wasn't my decision. I was just listening to President Trump's directive on this issue. Well, we now know that is false. Independent fact checkers, Political Fact, have come back and said that is a false statement by the governor on this situation. Accountability and justice demands that he be held accountable for that decision. But more importantly, to me, who's been living this issue for the last 90 days, is that when this virus comes back, and I hope it doesn't, but I'm preparing for the worst, we better have a governor in New York, and Steve is putting the spotlight on the governors across the country. You better not make the same mistakes that ended up killing tens of thousands of our grandparents because of your incompetence. What we should do is acknowledge the mistake, move forward together, and convene whatever necessary resources that we need to make sure that we have designated facilities to take COVID-19 positive seniors, make sure that they're isolated and they get the best care that they deserve as our grandparents rightfully do deserve, that their co-residents are protected and separated until those seniors clear the virus. I'll just tell you, we also have to make sure we understand how we're going to test for the virus going forward. When the governor rescinded his order, he also went the other way. And he put an undue testing burden on our nursing homes. And now he's obviously seen some data that we put in front of him in regards to public sources that highlighted this, and he's rescinded that order. And what I'm just asking is that the governor come clean, acknowledge this mistake, and make sure that when the virus comes back, that we're working together in order to protect our grandparents. And that's why I was so disappointed the last time we did one of these special meetings and special press conferences, because we had set up the author of that letter that wrote to the governor the day of the order that killed close to 10,000 New Yorker grandparents. We set up a meeting with the health facilities and the nursing home operators. And it was going to be off the record. It was going to be a candid conversation to debrief on what happened and make sure that when we go forward, we would make sure that our grandparents were safe and secure. And they have the audacity 40 minutes prior to that meeting to just say, you know what? It's not worth our time. It's my way, the highway is what the governor's essentially response was. And he wasn't even going to sit down and listen to the folks that lived this just like we did during the last 90 days. That's appalling. And I just got to tell you, we're going to continue to fight for those grandparents, honor the ones that lost their life during this period of time. And I would hope that we would be able to come together and make sure that our grandparents are never subject to this risk going forward. Now, that being said, I want to introduce our great whip, Steve Scalise, who I've known for years, and good, honorable man who is taking the lead in regards to the oversight efforts that are being done on the national level. Because what we're finding is that this appalling behavior is not unique to New York. Steve Scalise is leading the charge on behalf of all of us on the Republican Party, but also as members of Congress, to investigate the deaths of these seniors that have happened across the country during COVID-19. And I just got to say, thank you, Steve, for being with us. Thank you for your leadership. I know by doing this together, I am very confident with your leadership that we'll make sure that those deaths of our future seniors are averted because you have responsible leaders like yourself at the helm. So without further ado, the Republican whip, Steve Scalise.
Well, thank you, Tom, and really appreciate how passionate you've been about trying to uncover the facts about this. This has been something that, we've been doing a lot of work on looking into the coronavirus. I know right after we passed the last relief package, we did the CARES Act, we did some other things to create the Paycheck Protection Program, put over $2 trillion out there. Then Speaker Pelosi put together a select subcommittee to actually oversee what really happened and start looking at more of the details of the coronavirus, called the Select Subcommittee on the Coronavirus Crisis. She put the House Majority Whip, Jim Clyburn, in charge as the chairman of that committee, and I was selected to be the ranking member, the lead Republican on that Select Subcommittee. We've had a number of hearings, and we started to dig in a few weeks ago into just how many different groups this virus that we're finding out more about every week has been impacting differently in disparate outcomes. And clearly we looked into some communities. We saw early off the African American community was being hit harder than non-African American communities. And then you saw things like diabetes, hypertension, people with certain underlying pre-existing conditions were much, much more at risk than people that didn't have those same underlying conditions. That's why we saw young people not being as affected, almost none at all being considered casualties of COVID-19. And so the more we can find out, it helps us to understand what to do in terms of a national response. We had the entire nation's economy shut down to make sure our hospitals didn't get overrun. And fortunately, no hospital was overrun. There was not one person in America that was denied a ventilator or ICU treatment or any other direct care. And you saw, of course, in the case of New York, which had the first major outbreak, President Trump sent the ship to over 3,000 bed military vessel to make sure that there was additional capacity to handle COVID-19 patients. But as we were doing this investigation, we started seeing some alarming numbers, and that was the dramatically disparate impact COVID-19 has had on not just senior citizens in America, but seniors in nursing homes. And eventually there was a lot of research by medical scientists that uncovered that over 40% of all American deaths from COVID-19, roughly 42% just from the data we have, and I'm going to get to why that's an important point in a moment, but just from the data we have, over 42% of all American deaths from COVID-19 come from less than 1% of the American population, and that is seniors in nursing homes. So clearly, we started to dig deeper into finding out what went on and why can there be such a dramatic disparity in that community of seniors in nursing homes. And that's when we got to these orders that were given by Governor Cuomo and 4 other governors. If you go back to early March, as we were finding out about COVID and its impacts, clearly the Center for Medicare and Medicaid Services, CMS, which is under HHS. I know y'all are all familiar with CMS. CMS has given 14 different sets of guidelines on how nursing homes can properly take care of seniors in nursing homes. And one of their guidelines that was issued March 13th, prior to when all this started in New York, March 13th, they issued a set of guidance that made clear that the only way a nursing home should take back a senior from a hospital, let's say you had a resident of your nursing home, they started having symptoms, you sent them to the hospital, maybe they tested negative, maybe they tested positive, maybe they had something else, but they were clear that the only way the nursing home could take them back from the hospital is if they, number one, if they weren't COVID positive, but if they were COVID positive, you as a nursing home had to show that you could properly isolate, properly quarantine, properly take care of that resident. Otherwise, under the CMS guidelines, you shouldn't take them back. Now, as we know, nursing homes are regulated at the state level. So CMS gave this guidance, and again, over 14 different times as we found out more things, they were updating it, but they were always clear what should be done to properly take care of a nursing home resident. For whatever reason, and this is something that we need to find out about, for whatever reason, on March 25th, after that CMS guideline, this is when Governor Cuomo issued this order. And this order goes on to say, no resident shall be denied readmission or admission to the nursing home solely based on a confirmed or suspected diagnosis of COVID. So they said, you can't deny them coming back if you're a nursing home. But then it went on further, and he expressly prohibited nursing homes from testing COVID-19 patients, prohibited them from doing it. So you're now giving the governor who regulates nursing homes is telling the nursing homes to violate the CMS guidelines that the governor was given. And 4 other states did this, by the way. You've got, of course, Governor Cuomo. Then in New Jersey, the governor issued a similar order that literally is almost cut and pasted word for word in the directive that Governor Cuomo gave. So clearly there had to be some coordination between the 2 of them, where they, even the language on prohibiting the nursing homes from testing patients coming back from the hospital for COVID was almost verbatim from New York. Then you went on to see Pennsylvania, Michigan, and California do the same thing. And this had deadly consequences. Again, Tom talked about the numbers. We're talking about more than 6,300 New York residents that died in nursing homes from COVID-19. We don't know how many. We want to find this out, but how many thousands? We know the numbers, well over 2,000 of those nursing home residents died after the CMS guidelines came out and after Governor Cuomo contradicted those CMS guidelines by forcing the nursing homes to take them back without allowing them to even test those nursing home residents for COVID. And I'm talking about nursing homes that did not have the ability to quarantine and to properly care for, or the staff to properly care for those nursing home residents. They should have stayed at the hospital where they could have properly been cared for, but instead they went back to a tinderbox. And, you know, I think you all have seen the data now to know just how deadly COVID can be to certain populations. Do you really want to take the most at-risk population, seniors in nursing homes, and send a known COVID positive patient into that environment where that nursing home doesn't have the ability to self-quarantine? When they're getting meals, some nursing homes have the ability to have the meals served in the room. Most of them have joint shared facilities. So they're going back COVID positive and they're infecting other nursing home residents, and thousands of nursing home residents died. These were all preventable. We want to know how many, because unfortunately New York stopped disclosing the data. I know they still have it. They were still collecting it. They just stopped sharing it with the public. So I've sent a letter to all of these governors who went against the CMS guidelines. And I've asked them to give us this information, to give this to the Select Subcommittee on the Coronavirus Crisis. Things like, for example, all state-issued directives dealing with nursing homes as it related to this COVID crisis. The total number of COVID-19 related nursing home deaths from January 1st to today. The total number of COVID nursing home positives from January 1st to today. The total number of confirmed or suspected COVID patients returned to a nursing home from March 25th, when the governor gave that deadly order, to today. We've been asking for this for weeks now. I've called on Governor Cuomo and these other governors to come before our Select Subcommittee to explain why they gave this order to violate the CMS guidelines. And by the way, and I've heard this now a number of times, and I think Tom touched on it, Governor Cuomo's latest explanation is to blame CMS, to blame Washington, the Trump administration somehow, for saying they just followed what the government said they had to do at the federal level. That's been, as Tom pointed out, it's been fact-checked to be a lie. Seema Verma, by the way, has been very, very clear on this. The head of CMS said, quote, "Under no circumstances should a hospital discharge a patient to a nursing home that is not prepared to take care of those patients' needs," close quote. That's from the head of CMS, and Governor Cuomo is trying to say, oh, he was just following their guidance. His order went directly against that guidance. We want to know why he gave it. Who else was he working with to come up with this? And where is the real data? How many people died? We know, as Tom pointed out, over 6,300 total New York nursing home deaths so far that we know of. But we also know that over 2,300 died after that order was given for those COVID positive patients who were forced back to the nursing home. So anyway, I know that you have some questions. That is the background. We have that letter out there to all of those governors. I still haven't heard back from any of the 5 governors that gave these deadly orders, but we're not going to stop. I'll tell you who I have been hearing from. I have started hearing from a lot of residents in New York who lost their parents and their grandparents to this deadly scandal, this order that was given. They want answers. They deserve answers. These families never got closure. Many of them never even got to go see their loved ones before they died because of the quarantine situation, where they weren't even allowed to go into the nursing home. They weren't even allowed to have a funeral where the family could go and pay their final respects and get closure. So they want answers, and they deserve answers. I appreciate that Tom is fighting for those families. I know there are others that are fighting as well, but we all ought to be seeking these answers, and Governor Cuomo deserves to give the answers to these questions. And with that, Tom, I turn it back to you.
Well, I so appreciate that, Steve. I really do. And as often has been said by the governor, when he looks at these numbers, that there are people behind these numbers, and at a minimum, Governor, this is 6,300 of our parents and our grandparents that have died, and no answers have been provided to provide them comfort or accountability or justice for their deaths. These are real people. And I know you're going to fight for them, Steve, and I'm going to fight for them as we go forward. And God forbid, we're going to make sure this never happens again. So, Nate, I know we got a slew of folks here. What do we, you're at the head.
Great. Thank you both. So as I said, folks, you should have the capacity to unmute yourselves. I'm just going to go down the line and give you the opportunity to ask a question. If you're on the phone, you can hit *6, and that will unmute you as well. So let's start with Jerry from Buffalo News. Did you have a question, Jerry, for the group?
Yeah. Hey, Tom. How you doing?
Going well, Jerry.
Good. Now, in the Buffalo area, we've certainly had nursing homes that complied with the governor's order and had huge problems and many deaths. But we've also had nursing homes that basically quarantined their residents who had tested positive for COVID-19 and did not have a problem because they kept them in a separate facility, et cetera. How much responsibility here do the nursing homes bear in New York State?
Well, it's a great question, Jerry, because the nursing homes obviously try to step up in those situations, isolate and quarantine. But as Steve pointed out, the order went further to just mandating that the grandparents had to be returned to the nursing home facilities. They couldn't even test them. And so you had nursing homes. I remember in real time, we were doing daily calls with these folks. They were pulling their hair out. They didn't know what was going on. They had all this confusing information coming from Albany, and we were putting them on notice. You got a written notice provided to the governor directly that this was killing seniors in real time. And so nursing homes, the ones that, that followed common sense and isolated and quarantined those that they knew were COVID-19 positive, the numbers speak for themselves. The impact on the deaths in those nursing homes were limited compared to what happened with the nursing homes that were trying to follow these orders that were coming out of Albany. That made no sense to them, but they were the orders. They're the ones that were being subject to potential closure orders if they didn't follow the directives from Albany in regards to their licenses. So, your question is spot on to exactly why we have to learn from this situation so that we make sure when the virus comes back that we never put our seniors into this crossfire of potential threats.
Tom, if I could jump in on this, because we did a lot of research during our investigation into the disparities, not just between the nursing home population and the rest of America, clearly dramatic disparities there. Again, 42% at a minimum of all COVID deaths in America are seniors in nursing homes, which represent 0.6% of the American population. So there's already a disparity, but not all nursing homes had the same outcomes. And if you look at the other states where they didn't get these orders, and remember, the governor is the regulator for nursing homes. The federal government can give guidance, as you're seeing the president through Dr. Fauci, Dr. Birx, and others. They give guidance to states, even on phase 1, phase 2. Each state had their own reopening plan because states are the ones most in charge and know their populations. But the state, in this case, is the regulator for nursing homes, and the governor issued the guidance. Now, I will tell you, there are nursing homes that had the capability of isolating, of quarantining COVID positive patients, and were able to do it effectively and successfully because they were set up that way. In fact, these CMS guidelines accounted for this when Seema Verma said, first, under no circumstances should a hospital discharge a patient to a nursing home, but she said that is not prepared to take care of those patients' needs. So clearly there's an understanding by CMS that some nursing homes are set up properly to take care of this kind of situation where they can isolate nursing homes, but a lot of nursing homes aren't set up that way, just not how they're set up. And so what CMS was saying is you shouldn't have those nursing homes take those patients back. And yet the governor went a totally different direction and said, you have to take them back. And he prohibited the nursing homes from testing. Look, for example, at the state of Florida. It has a much higher nursing home population. Florida has a higher percentage of senior residents. And yet, because the governor of Florida followed the CMS guidelines, in fact, Governor DeSantis's directive, we showed this in the committee hearing, went the complete opposite direction of Governor Cuomo. He prohibited the nursing homes from taking these residents back that were COVID positive in the hospital if the nursing home couldn't properly take care of them. Do you know that at a minimum, there were 500% fewer nursing home deaths in the state of Florida? Over 500%. Some estimates that have gotten better data from New York that we're trying to get estimate it's about 900% fewer deaths in nursing homes in the state of Florida versus the state of New York. That shows you how dramatically different, because one governor followed the CMS guidelines, another governor, in this case in New York, decided to do his own thing and go against those guidelines with deadly consequences.
Okay, thanks.
Thanks, Jerry.
Thanks, Jerry. All right, let's go to Bernadette Hogan with New York Post.
Hi guys, thanks for doing this. Can you hear me okay?
Yeah.
Yeah, Bernadette.
Great, thank you. So first question is, have you today's Thursday, but have you reached out to President Trump on this or any staff, and has there been a response? And second, Governor Cuomo yesterday was saying that the policy of putting asymptomatic workers and interacting with COVID positive patients in nursing homes also contributed to the high death toll. So, they were doubling down on the March 25th directive as coming from CMS federal guidance, but then they were also saying what compounded the issue was the asymptomatic contact of nursing home staff. So wondering what you think about that. And also at the end of the day, was that preventable? Because of course we saw that in hospitals too with, people coming into contact with, outside family members and then coming back in and dealing with patients. So do you think that also had to do with this high death toll that we're seeing in New York?
Steve, please go right ahead.
Bernadette, and to start with the question you raised, was it preventable? The saddest part of all this is that this was very preventable. So many of these thousands of deaths were preventable. And so if you look, for example, and by the way, I've spoken directly to Seema Verma about this, because you've got Governor Cuomo pointing his finger going, hey, I was just following what the federal government, the Trump administration told me to do. Again, he was fact-checked to have been false on that claim. But I wanted to hear it straight from Seema, because she's the one who issues the orders. And I've worked with her on a lot of things. She's very well respected as a health professional administrator who really does understand how to handle the areas under her jurisdiction. And she said, Steve, absolutely not. In fact, I gave the opposite directive. We gave guidance, guidance after guidance. And again, they've issued about 14 different sets of guidance on how, as we know more, how to better take care of nursing home patients. But every step of the way, they were saying, don't send them back unless the nursing home can properly take care of them. And you point out, some nursing homes are better prepared than others to handle seniors that are COVID positive. But the directive from CMS was, if your nursing home is one of those who's not prepared, then you should not take them back. Governor Cuomo went the opposite direction and said, you have to take them back. And if you look across America, and again, we've looked across the country, this isn't a Republican or Democrat thing. 45 governors did much better job, dramatically better than this. 80% of all nursing homes, by the way, did not have these problems. 80% of all nursing homes. So it wasn't just, good luck or bad luck. It was really deadly directives from these 5 governors that accounted for about half of all the nursing home deaths in America. Imagine that. I mean, over 40% of all nursing home deaths in America happened in only 5 states. And oh, by the way, it just so happened to be the 5 states where the governors gave directives that contradicted CMS guidance every step of the way. I've talked directly to Seema Verma about it. She's adamant, and you could talk to her as well, but she's been very clear recently as the governor's been trying to blame her, saying, oh no, you go look at the guidance from CMS. I mean, CMS was very clear, don't take these residents back. You should not send them back. Again, CMS doesn't regulate nursing homes, the states do. And the governor said, okay, I got the guidance from CMS, but 12 days later, March 25th, Governor Cuomo said, I'm going to do it differently. I'm going to force the nursing homes to take them back. That was against Seema Verma's guidance from CMS, and it had deadly consequences.
And as we also talked to Seema, and remember, Seema is the head. This is a key individual in the Trump administration. So the administration, we have been communicating with them throughout this entire course of us looking at the nursing home deaths. And I know Steve talks to the White House often. So this is something that is not going away, and rightfully so. And so it's going all the way to the top, and we'll continue to raise awareness on this issue and get to the bottom of it. And the biggest question is why? And to just be, for the governor to just flippantly just dismiss the killing by his hand of close to 6,000 plus to close to 12,000 in my opinion, but at least 6,300 of our grandparents. That flippant, arrogant attitude, it just infuriates me. And I'll tell you, we're not going to stop until we get the answers, and we're not going to stop until we make sure that our grandparents who are still with us and our parents that are still with us have the best opportunity when this virus potentially comes back to make sure that they're safe and sound going forward. As to the employee testing, this was also an issue raised in real time, and it was confusing to all the public health officials. And in one of our local counties, Jack Wheeler, he led the charge in regards to raising this issue of testing the employees and making sure that that vector, that threat that was going into the nursing homes was closed. And the issue was it wasn't recognized by the state as a threat during the time. And so the testing is important, but testing that can be practical, testing that is based on data and science, because then you got the governor's order of twice a week testing that just was impractical. The burden of the financing of it was threatening to shut down our nursing homes. And so he backed off, looked at the data from CMS, looked at the data and the scientific evidence, and came back to the once a week testing that is reasonable and responsible and actually practicable in order to identify the threats to our nursing home setting. So this is a question the governor has to answer. And by his silence, all I can do is speculate. Clearly something was going on here with these governors, that they were responding not to the science and data. They were responding to some other interest that we just don't have the answers to at this point in time. But I'll put on your radar, The Guardian, not an ultra-right piece of publication out there, investigated the governor's campaign finances. $2.5 million given to the governor from the health industry. Maybe there's something there that could be looked into a little bit closer, and some hard questions being asked of these governors as to who were they responding to. Were they responding to political interests, or were they responding on behalf of our grandparents to make sure that they were safe and sound? That's a question only he can answer.
Thanks, Bernadette. All right, let's go to David Robinson with USA Today.
Yes, hello, can you hear me?
Yep.
Yes.
Yes, thank you. I just wanted to get you to see if you could expand upon what steps you've taken to compel Governor Cuomo and the other governors to disclose the data you've requested, specifically the numbers related to how many residents who were positive who were readmitted to nursing homes since the orders and directives took effect, and also what steps that other federal agencies that you've spoken with have taken as far as their investigation into the effort.
Well, I can't speak to other federal agencies, but I can tell you that last week, myself and 4 other members of the Select Subcommittee on the Coronavirus Crisis sent letters to New York and the other 4 governors who gave these deadly orders, asking them for this data, including, as you mentioned, the number of COVID-19 patients who were sent back to the nursing homes from the time that the governor gave the order March 25th. I have not received that back yet. My staff has been asking for weeks now. We formally sent the letter last week. I've called on the committee to bring the governor to our hearing. Obviously, the chairman runs the meetings, and he hasn't agreed to do that yet. But frankly, I think we ought to know those answers. And as Tom has pointed out, the families deserve to know the answers to these questions for a number of reasons. One, to have real accountability for why these deadly orders were given. It's a mystery to us why they did it. Again, you look at the New Jersey order, and it's almost verbatim in some parts to the New York order. So clearly there had to be some coordination going on between these governors who did it. Why did they choose to go against CMS guidelines and join together? But also, we don't want this to happen again. I'm with Tom. I sure hope that there's not a second wave, but we have to prepare for a second wave to possibly come later in the fall. And if that happens, now we know a lot more than we knew when China hid this from the world in the beginning of this year, when they were saying it wasn't going to be transmitted from human to human. We know so many other things about COVID-19 now than we knew before, but one thing we know is it goes after and targets seniors in nursing homes at much higher percentages than anybody else, so we better get ready for that. And we better make sure that the guidance is not only out there and crystal clear, but that these governors who did it, 46 days Governor Cuomo had this order out there before he reversed it. Why did it, the fact that he reversed it tells you he finally acknowledged that it was killing people, but why did he wait 46 days? And why, as Tom said, did he give the order in the first place? We deserve to know those answers. I hope he turns that over quickly. He talks about transparency a lot. Now's the time to put your money where your mouth is.
Amen. And we also, in those conversations with SEMA, asked for whatever authority they have to be fully pursued in regards to they provide a lot of resources, financial resources for Medicare and Medicaid services. And with that should be some accountability, in my humble opinion, that could be instituted in regards to their agency powers. But we're also on the Ways and Means Committee. We got a subcommittee hearing. Looks like it's going to be scheduled in our oversight role. And this is an issue in our health subcommittee that I intend to raise in regards to the oversight function that we have in the committees on what happened here. And so we're not going to stop. These questions have to be answered, and the only person that can answer them in New York is the governor. And for him to just flippantly, just outright lie, it's just so disrespectful to those parents and grandparents who died. I mean, I talked to these people. Their families are at a loss. They have no answers as to why this happened. And also, they are legitimately saying, is this going to happen to my neighbor's mother or father if this comes back, if this virus comes back? And what am I supposed to say to them? Oh, no, the governor just got away with it. No accountability and not changing any of his practices. I'm sure when the virus hits again, he'll go on and do a press conference. Everybody will pat him on the back. But when the lights are off, you know who's working 24/7? Guys like Steve Scalise and myself, making sure that those seniors are protected as best we can. And at least what you could do, Governor, and I'm speaking directly to the governor now, is listen. Listen to the people. They were telling you in black and white during this. We convened an off-the-record forum to have a candid conversation about this. And you ignore it. That's not leadership. That's just showboating.
Well, in the Society for Long-Term Care, I think Tom touched on this earlier. The Society for Long-Term Care, immediately after the governor gave the order March 25th, said, please don't make us do this. This is going to kill people. That was the day after he gave the order. And again, for 46 days, this went on and thousands of seniors died unnecessarily. We deserve answers. Tom has raised that multiple times. The governor needs to explain why he did that, going against the scientific guidance.
Amen.
Thanks, David, for the question. Let's go to Ryan Whalen with Spectrum News.
Hey, gentlemen, how are you?
Good, how are you?
Good.
I'm going to try to punch in a couple of questions here. Is there some recognition that these states that you're saying account for, I believe, 40% of the nursing home deaths in the country were also the states with the most prevalent amount of cases of coronavirus in the United States, and how do you factor that in? And with New York, from what I understand, the nursing home deaths that they're counting are the ones that happen physically in the nursing homes.
Mm-hmm.
Is that your understanding of how other states are counting these deaths? And is there a way to track what happened when someone, say, left a nursing home, was positive at a hospital, and then died?
Yeah. First, Ryan, let me flip that question around, because as you talk about, did this happen in states where they had a higher percentage of COVID positive patients? The real concern that we've been raising is one of the reasons New York had such a high percentage of COVID positive patients is because they went against the scientific guidance given by CMS to put thousands of seniors at risk and ultimately allow them to become COVID positive in ways where they would not have become COVID positive if they were better protected. If the governor followed the guidelines from CMS, you can look at the other states. Again, 45 states got this right. And in those 45 states, they had dramatically lower numbers of COVID positive patients, and they had a dramatically lower number of COVID deaths because they followed the guidance. So the governor can't say, oh, well, it happened worse in New York because we had more COVID positive patients. He created more COVID positive patients by putting more seniors at risk. And again, the most vulnerable population of all people in America to COVID were our seniors in nursing homes. And he put more of them at risk by forcing COVID positive nursing home residents to go into a nursing home who then infected other people. And so the number was higher because the governor gave that deadly order that should have never been given. New York would have had a dramatically lower number of COVID positive patients, and New York would have had a dramatically lower number of COVID deaths. Thousands and thousands of people that would not have died, would not have been COVID positive if he would have just followed the federal guidance.
And Ryan, you ask a great question. And that is why we're asking the questions now. Because look at what happened in New York and New Jersey who had the exact same orders in coordination with each other in regards to nursing homes having to take these COVID-19 patients. I would surmise, I would speculate, and that's why we have to ask the questions and chase the data, that had a huge impact on the national exposures to this virus that you're referencing in the data question that you asked. And let's be very clear, the virus doesn't know where a state boundary is. It doesn't go, oh, we're just in New York, so clearly we're only going to infect New Yorkers. And then so New York has some unique exposure history to the virus. There are commonalities here that you can see in the data on its surface that are asking the serious questions to be had that says, why? Why is New Jersey and New York doing the exact same thing? And obviously the virus is showing a huge impact in that area of the nation. So you got some major red flags here, a lot of smoke going off as to what happened with this virus. And I just got to again assure you, this is not the end of these questions. This is the beginning.
And on
Thanks,
the
Ryan.
question about compiling data and how other states are compiling the amount of deaths that they've seen as opposed to how New York is doing it.
Yeah, that's exactly my understanding. Steve may be able to answer that better, but I know in New York, that's one of the concerns I have, and that's why I do believe this number is going to be twice as high when it ultimately is peeled back. Because they physically said, well, if you died in a nursing home, you'll count towards a nursing home death. But if you're a nursing home resident that went to a hospital and you happen to die in the hospital, we're not going to count that towards the nursing home facility. That's exactly the information Steve's seeking that I sought and I'm continuing to seek from the governor and got no response from in regards to why did you make that distinction between the two? And can we not correlate the two back to the nursing home because that's where the individual who passed in the hospital came from. So Steve, I don't know if you have found that in the data.
We're trying to get that data for the very reason you mentioned, Tom, because, as we can all imagine, if a COVID positive patient, if you're self-quarantining in your house and you go back home and you're not socially distancing from your spouse and your kids, they're going to have a higher likelihood of coming into contact and ultimately becoming COVID positive. When you force a nursing home resident to go from the hospital, COVID positive, back to the nursing home, and again, the governor prohibited the nursing home from even testing them to know if they're COVID positive, and you don't have the ability to self-quarantine. That means that patient's going around, and some of these nursing homes have over 100 residents. And so you saw in some of these nursing homes, dozens of other people were getting infected with the coronavirus who otherwise would not have come into contact. If the governor followed the CMS guidelines, that COVID positive patient would have stayed at the hospital or gone to the Navy ship and stayed on the Navy ship and not going back to the nursing home to infect all those other people, many of whom, by the way, then went to the hospital. Some died at the nursing home, and we have some of those numbers, but some were sent to a hospital because they started to become gravely ill, and then they died at the hospital, and they weren't counted as a nursing home death, even though they were infected at the nursing home because of those patients that came back from the governor's deadly order. So we want to find that out. We're trying to find it out. There's no reason why the governor is hiding this data from us. They've got it. They've collected it. But for whatever reason, they just stopped reporting it. Again, if you believe in transparency, as he says he does, then show us this data.
And then you also got to follow the virus the other way. If I could humbly add a little something to this. So if you create a hot zone because you're sending these seniors back to the nursing home, that means those fellow nursing home residents are getting exposed and getting the virus. But then those employees that are coming in who are clean, who don't have the virus, now get exposed to it and bring it back home. So now they go back to their normal day-to-day activity. They expose their family members. These workers are now a vector, not only going into the nursing homes, but going out of the nursing homes. That is why this was such a reckless order that has such impact on these overall deaths that impacted the country, in my humble opinion. And when the dust all settles and all these questions are answered, I think you're going to see this was the major vector that got the virus to the level that it got to in regards to killing the 100,000 plus Americans that we see now in that death toll that's being counted.
Thanks, Ryan. All right, let's go to Joe with the Wall Street Journal. Did you have a question, Joe?
Yeah, hi, Congressman Reed. I was wondering, could you talk about the first couple of times your office brought your concerns about the nursing home EO to the executive chamber, who you spoke with and the response that you got?
Yeah, so obviously we did it in real time, and we followed up on the long-term care letter, and then also working with our public health officials like Jack Wheeler. Jack Wheeler was really, he's our emergency management officer in Steuben County, and we worked with the Department of Health director out of the Buffalo office, who we raised the concerns with. And I will just tell you, Jack was really the one who led this charge in regards to the relationship that we had on those daily calls and those communications with our public health officials. So we'll get you names. Sarah from the governor's office, who is the governor's point person, supposedly to communicate with us, who I talked to on Easter Sunday when we delivered 4,000 masks to a nursing home in Tioga County. And she was very helpful in that communication. We relate to her questions and concerns that we're discussing here today. In particular, that meeting that we put together of the folks where we could have a candid conversation about what happened and let's do what we have to do in order to make sure this doesn't happen again. She was the one who was the messenger who delivered to us that we're not coming, and you go pound salt. But I appreciate the work that Sarah does. She's just listening to her boss, and I appreciate what the regional director out of Buffalo was trying to do, but he was listening to his boss. And my understanding in some of these conversations is that some of these orders were coming out at press conferences in real time, and the Department of Health officials had no idea. Zucker himself had no idea what was coming, or that these types of decisions were going to be issued and edicts would be delivered from a press conference the way that they were. But we'll get you the list of each of the employees that we talked to, and we will also ask that you please ask the governor, why were you making orders off the cuff during press conferences without even informing your staff as to what was going on?
Thanks, Joe, and I'll be sure to follow up. All right, let's go to Matt with Lilly Broadcasting. You have a question, Matt?
Yeah, Congressman, can you hear me?
Yeah, Matt.
Perfect. Good to see you both again. Thanks for holding the call. This is a fairly broad question, but because this is happening in more than multiple states, more than just New York, wanted to see what you feel is the best move forward if there is another wave, a second wave, legislation in Congress, better CMS recommendations. What do you think is the best protocol moving forward to ensure this doesn't happen again?
Well, Tom, if I could jump in on this, because I've got another call I got to get on at the top of the hour. But
No,
one of the reasons we're trying to find out what really happened is because we need to be making smarter decisions if this does come back based on what we now know. Again, we've learned so much about this. You can see as people are going about their way of life. If you go to a restaurant today, it's a different experience than it was pre-COVID. But even like if you go to the grocery store, which never closed, grocery stores were able to stay open through this because they were essential. Your experience at a grocery store a week after the shut-in is much different than your experience if you went today or 3 weeks ago, because now more people are wearing masks. They're doing different things to wipe down and sanitize. They're putting up the screens that wasn't there the first few weeks after the shut-in, so that the people that are working behind the checkout register are better protected, because now we know that gives you better protection. We are learning more about this every week, and we're trying to incorporate that into what we do. Now, the federal government isn't the regulator of nursing homes, states are. And we're not looking to get into that business, but we absolutely want to get the facts out, because again, 45 of these states got this much better, did it right. 80% of nursing homes in America didn't have these problems. So as you look at the numbers, it would look like, gee whiz, being in a nursing home is the worst place to be, and it's dangerous for COVID-19. But most nursing homes were able to protect themselves from this and didn't have these deadly orders given by their regulator at the state level, and so they didn't have those outbreaks. Yes, if we can put legislation into to better protect seniors in nursing homes, we want to do it. Tom's been talking about it. By the way, I've got colleagues in other states that had this problem that are concerned and trying to raise this issue as well, because we want to find out more about it and then share that with everybody else, just like with standards for going out to a restaurant today, because of what somebody might be doing at a restaurant in Miami that opened earlier than a restaurant in Corning New York or a restaurant in New Orleans, we can see what they're doing that's smarter and better and share it. Sports leagues are sharing information now as they're getting ready to start letting fans in to events. So we need to get the information so we can share it with others and save more lives. So it's important to get this data, and we're going to keep fighting to get it. And I appreciate that Tom is leading that effort. I know I've got to jump off, but Tom, thanks for your leadership. I'll continue to work with you. We're going to continue to find these answers. I know a lot of you are digging and try to find it as well. Hopefully, we'll get the data that we need and then be better prepared to protect more people in the future if this does come back. And hopefully this never happens again. And, you know, these governors get held accountable, but they also explain why they did it and stop doing it. You know, in some states, they're still doing it. At least after 46 days of a deadly policy in New York, they finally reversed it. But it should never happen again. It shouldn't have happened in the first place. It should never happen again. Tom, again, thanks for your leadership, and I apologize, I've got to jump off.
No, I totally understand, Steve. Thank you for your leadership and what you're doing on this, and thank you for spending your time with us.
Thank you.
And I'll add to this question, and I don't put myself out as an expert in nursing home, but I'll tell you what I have learned over the last 90 days just with my own self-reflection and diving into this issue, and some recommendations that I would put on the radar is right now we have a window of opportunity to make sure that the regulatory bodies are issuing the orders and are working together to, one, replenish the stockpile in New York State. We're working at the federal level to make sure that the stockpile is there, and so that we have access to the equipment, especially when it comes to personal protective equipment, PPE, and that the nursing homes are brought into this and their supply chains are tested and recertified so that they have the access to that resource if and when they need it. But most importantly, we should make sure that we have in place the facilities and the testing protocols to make sure that if there are coronavirus seniors, if there are coronavirus residents of nursing homes that are identified, that we take immediate action to put them in facilities that are housing or isolating those COVID-19 positive patients and residents and separating them as quick as possible from the negative COVID-19 residents in the nursing home facilities. That plan should be developed now. We demanded that 30-some days ago that they should be working on this. And so if you actually put in black and white the resources to protect our seniors, plus the facilities, you actually give seniors the best care because then you would have COVID-19 specialists that had learned so much on this virus in those facilities to treat those individuals. And you would be in a position to mitigate and make sure that any potential deaths in the future are brought to as close to zero as possible. I recognize you're not going to be able to mitigate the risk to completely to zero. But my God, we have a window of opportunity. Why don't we take it and work together rather than trying to deflect, cover up, and point fingers that ultimately are proven to be false by independent fact checkers? Now is the time not to point fingers. Now is the time to move forward by being honest with each other and working together in regards to a plan that will keep our seniors safe.
All right, let's go to Michael with WBEN. Question, Michael? Okay. All right, Julia Schneider. Did you have a question, Julia?
Yeah. What kind of accountability are you looking for the governors that were in the 5 states that had these issues?
Just acknowledgement and a debrief of why in black and white this order was issued. What was the decision-making coordination between the powers to be? Because you clearly have 5 governors that are doing something different than the 45 others that went a different path. And to make sure that we understand that decision-making process. And accountability, I mean, the sooner you come clean, the sooner there doesn't need to be additional sanctions or penalties. But if you continue to hide and deflect and to lie and to cover up, then I would say the culpability demands some type of penalty to these programs, to these departments, that as well as the governor himself in regards to holding them accountable.
Thanks, Julia. All right, let's go to Rick Miller. Okay. Let's go to, I think we're almost at the close here. I think there's one or two folks. I'm just looking. Melissa Holmes, did you have a question, Melissa?
Sure. Congressman, you just mentioned additional penalties. What, in your estimation, would be an appropriate penalty if the result of the investigation found that there were grave mistakes made?
You know, I am not making it a priority to penalize by way of fiscal penalties or regulatory penalties or anything like that. This is really about just accountability. My goodness. I mean, just a simple, you know, acknowledgement of how this went down in black and white so that you could honestly review it and then say, you know what, if there's shenanigans going on here that warrant further investigation, i.e. the concern about those campaign funds, the $2.5 million reasons why Governor Cuomo may have done this decision, maybe that has different ramifications that get into the other areas of the law. But bottom line, this is about just accountability from the sake of why did this happen? And let's put it out there so that these 4 other governors and most importantly, the 45 other governors do not go down this path if and when the virus rears its head, and that we position ourselves as a nation to protect these seniors that clearly the virus is targeting, given its preference to really cause drastic impact to this population.
Thanks, Melissa. All right, let's go to Gary with Democrat and Chronicle. Did you have a question, Gary? Great. And then let's go to Fred Balfour. Fred, did you have a question?
I did. Can you hear me okay, Congressman?
I can. Yeah, sure, Fred.
Please pass on to Steve Scalise that I was glad to see him here looking healthy because he had a tragedy 3 years ago.
Amen.
And he looked fit as a fiddle, at least from the chest up, which is all we can see in these Zoom meetings.
Well, I got to tell you, his recovery amazingly. Steve is a good friend, and we've walked with him in regards to this journey that he's had, and I appreciate that, and I'll relay those well wishes to him. But I'll tell you, his road to recovery is still ongoing. He is not. He still carries those battle wounds, literally, day in and day out.
I can believe that. I want to go back to March 14th. Steve mentions March 13th, CMS set standards for nursing home. On March 14th, 3 months ago, the New York Times reported that the Trump administration had started 11 months ago to weaken a regulation for nursing homes. And the regulation was that every nursing home should have on staff an infectious disease doctor or have an infectious disease doctor calling with frequency enough to cover that kind of thing. Or doing away with that regulation. And there were 17 state attorneys general who were called in March to the White House to ask what the status of that was. They deferred and pivoted and passed it off to CMS. So my question is, are these regulatory changes to reduce infectious disease coverage in nursing homes still being pushed in CMS? And this regulation taking away this, what I would call serious protection for seniors, is that still in place? And so if it is, what is the Congress going to do about that?
Yeah. So as has been pointed out multiple times, Fred, the regulations of nursing homes are done at the state level. The primary oversight and regulatory body work that regulates those nursing homes state by state. That has been the system. That has been the historic system for years. And so this requirement that you reference at the federal level is really dependent on what the states do with it in regards to the regulatory framework. So the states ultimately are the ones that control that edict, that any type of indications coming forward with it. My understanding on the status of this is something we'll have to check and get back to you on in regards to it. But my understanding is that everybody who's been involved in the task force and who's looking at this recognizes that the nursing home environment is a particular risk associated with this virus, and they want to strengthen that framework. They want to provide resources when it comes to nursing homes. That's why we put that $750 million potentially to the state, that the state has access to for testing. That should be part of the solution as to the open-ended question of who's going to pay for the testing of the employees of the nursing homes right now. And so there are resources not only there that will build off, in my opinion, in phase 4 to make sure that they have capacity in the nursing homes to deal with these separate facilities, as well as the PPE, as well as the testing requirements that are necessary to surveil the population to mitigate the risk. So I'm confident of the existing resources, and I'm confident in the future resources that will be there.
Sounds like you're saying then that the 17 states attorneys general that really acted against that change last July were really reacting against something that couldn't happen because the federal regulations don't have any impact. Is that what you're saying?
Yeah, essentially, this is all done at the state level, and so I'd encourage that pressure to be put there at the state level.
Okay, thanks.
Yep, thank you.
Thanks, Fred. All right, I think that should bring us to the close, folks. We appreciate you all joining.
All right, well, thank you, Nate, and thank you, guys. Really appreciate that, and thanks also to Steve Scalise for spending that time, and that shows you how committed he is to this issue. I've talked to him over the last few weeks in particular on this, and I'll just tell you, we're going to get to the bottom of it. So thank you so much, and look forward to working with you guys as we go forward on this and others.